Hello, guys. Good evening. This is Dr. Thompson, the instructor of the T Square OET Academy. What we'll be going to do today is to guide you on how you can expand OET notes and use them to form complete sentences. For you to write a good OET letter, you should learn how to identify relevant notes, expand these notes, and use them to form complete sentences. In our last lecture, I was able to teach you how you can identify relevant notes in your letter writing. In this lesson, we are going to focus on how you can expand these relevant notes and use them to form complete sentences. This was the case note we used the last time. In this case note, I was able to select relevant information for you. These are the ones highlighted in yellow. And for this one that we use, we put in a red bracket. This information, we are going to summarize this information and use it to construct, to form a complete sentences. All right. In order to expand your notes and use these notes to form complete sentences, first, you should learn how to summarize. Then secondly, you should learn how to paraphrase, and you should also learn how to connect your ideas logically. Let's start to how you can summarize information. Now, this is the piece of the case note that we are going to summarize. If you look at this information here, there are a lot of details here. For example, in the presenting complaints, this patient fell while climbing stairs on this date. She felt weak, legs gave away, fell backwards, hitting her head on the wall, no one to help, lying helpless for 6 hours. Here, this information at this point is not really that relevant to this note we are writing, because the purpose of this letter is for short-term monitoring for this patient. It's not as if we are referring this patient to the emergency for the doctor to know what is wrong with this patient and treat this patient. No, this patient has been treated. She's fine now. The patient is going home. So he's going to a nursing home to be monitored for a short time. So we are to summarize this information. Now, this is how I summarize both the presenting complaint, the examination findings, and the diagnosis for this patient. Here, I said Jean reported falling from stairs on this date and became frustrated, disoriented, and with a low blood pressure that suggests the cause of the incident may be due to orthostatic hypotension. So I've summarized all this information in a sentence without adding irrelevant information. And the gist, the relevant information that I selected, I expanded it and used it to form a complete sentence without writing it in a note form. Okay, now look at the treatment records and see how I summarize all this information in a complete sentence. She was treated with IV fluid and the dose of her medication amlodipine reduced from 5 mg to 2.5 mg. Following this, her vital signs are now normal and she has an unremarkable CT scan. Okay, this is how you summarize information. It's not all the time that you need to add all the details. What determines what you add, as I said in my previous lecture, is the purpose of the letter and who you are also writing, the problem you want to explain. Okay, I would really recommend you go back to that lecture and watch it again. If you've not done that before, I will recommend you look at that lecture and see how you can select important information that the reader will need. Now, let's talk about how you paraphrase information in your letter writing. Okay, there are different ways you can actually do this, but I'm only going to highlight these 4 methods and I really recommend you use them. when writing. First, it's changing the word form. Sometimes the word form can be in a noun form. You can change it to a verb form as described in this first example. She needs an assessment. Now, this assessment is a noun form, is now changed to the verb form. She would need to be assessed. Samantha has hypertension and diabetes. These are also in noun form, but here changed to the adjective. Samantha is hypertensive and diabetic. Here, I would appreciate your urgent review. This adjective and noun now changed to verb and adverb. I would appreciate if she is urgently reviewed. Another way you can also paraphrase is changing the vocabularies. This is the commonest type. This is the commonest means that people usually use. For example, this evaluation here, paraphrase to assessments. Management here, paraphrase to treatment. But the problem with this form of paraphrasing is that sometimes students they are tempted to change all words in the case note, which you don't necessarily need to do. For example, there are some words you really don't need to tamper with. For example, signs and symptoms in a case note. When you change signs and symptoms, trying to paraphrase them, most times it gives them another different meaning, and that will impact negatively on the clarity of that letter writing. So avoid paraphrasing signs and symptoms as much as possible. All right, you can also use what we call phrasal verbs. Okay, you can also use what we call phrasal verbs. These are what we call phrasal verbs, where we bring in verbs with preposition. Now, this verb reduced can be changed to a phrasal verb to cut down. She has reduced her alcohol intake. I can paraphrase it to she has cut down on her alcohol intake. Let's say I've used the word reduced in a particular paragraph, maybe to talk about the patient reducing let's say the patient has reduced the number of sticks of cigarette sticks she smokes. In the next sentence or in the next paragraph, maybe I want to talk about the alcohol. Instead of saying she has reduced her alcohol intake, using that word reduced again, I can paraphrase this time around to she has cut down on her alcohol intake. She was prescribed paracetamol. Maybe I've used the word prescribed before. I can decide to use a phrasal verb this time. She was placed on paracetamol. Another way you can also paraphrase is by changing the sentence structure. To do this, you can decide to explain the vocabulary instead of trying to use another vocabulary for it. For example, Mary has not been compliant with her medication. Here, the word compliant, I can decide to explain it instead of trying to use another vocabulary. Here, I said Mary has not been taking her medication as prescribed. Look at this example again. The diarrhea started yesterday. Here, I said he has been passing frequent watery stools since yesterday. Okay, now you've been able to learn how you can paraphrase, how you can summarize. The last thing that you must also learn is how you can logically connect your ideas. As a rule of thumb, whenever I'm writing, what I usually do, whenever I'm trying to explain patient treatment, I usually like to start from the symptoms, connect it to the signs, connect it to the investigations, then treatment, and finally recommendations. It's easier to write that way. It's more logical to approach it that way than maybe you are trying to summarize patient treatment. You are starting from the recommendation you've made before telling the reader what the patient presented with, the signs, and then before telling the reader the treatment. Okay, it's easier to flow from what the patient presented with, your own examination findings, the investigations you carried out, the treatment you offered, and finally the recommendation. Now, all that I've said, let's take a look at how I use them to write this letter in full. Now, this is the letter. Go through that case note carefully to see why this letter is this way. This is the address. By now, you should have learned how to write the address of any letter. If you don't know how to do this, you can go back to my lecture on that. How to write the date, how to write the greeting, how to write the real line. Now, this is your introduction. If you've watched my video on how to write the introduction, there are two most important things you should always include in your introduction. That is the problem and the purpose of the letter. Now, if you read this introduction, Jean is a 90-year-old widow who was managed for suspected hypertension following a fall. She is sometimes disoriented, and I would appreciate if you can monitor her for a short term in your nursing home. Now, this patient's problem is this. Okay? Why this patient, what we want the reader to do for this patient is this. That makes your introduction. In the next paragraph, after writing the introduction, in the next paragraph, I discuss the treatment so far. Because the reader will want to get the summary of what I've done for this patient. What brought the patient to this hospital? What have I done? She fell in her apartment on this date, and that presentation was confused. The cause was presumed to be orthostatic hypotension, therefore was treated with fluids, and the dose of her antihypertensive amlodipine reduced from 5 mg to 2.5 mg. So this is a summary of the treatment given to this patient, or what brought the patient to the hospital and what I did. After you would have treated this patient, what next will your reader want to hear? Your reader will want to know, how is this patient doing now? Because this is a patient going to the nursing home. Is this patient in a good shape to come to the nursing home? Now, this is what I did in the next paragraph. Jean's vital signs are stable now, and a CT scan done showed no acute intracranial bleeding or tumors. But she is still experiencing occasional confusions, and her mobility is restricted. This is the summary of how this patient is doing now. And you can see how I paraphrase, how I try to expand the notes in this letter. Now, when I'm done with this, before telling the reader the details of what I want the reader to do, I would want to bring in, are there other background information? Are there other social history, background treatment that this patient is receiving that this reader would need to be aware of? Yes. So I can bring them in another paragraph. Please know that Jean lives alone without any form of support and has been managing osteoarthritis and hypertension with naproxen and amlodipine since 2006 and 2010 respectively. She also has headaches, and the etiology is yet to be identified, and this requires no medication but will need close observation. I think in the case note there, they use monitoring, but I said close observation here. In the case note, they said the etiology is unknown. Here, I said the etiology is yet to be identified. So just go through this case note and see how I paraphrase the different paraphrasing skills that I used in this case, in this letter writing. Now, to make my recommendation, although Jean would want to go back to her apartment, I'm worried that she may not be able to cope independently at home and would need to be evaluated. In order to improve her mobility, I would recommend more encouragement and assistance. And that's the end of the writing. If you need more information, please contact me. Yours sincerely, Nurse. Okay, and the whole of this, if you want to count your words, remember how your word count is done. From the introduction to the concluding paragraph, you have 196 words in this letter writing. Okay, thank you very much, guys. If you have not subscribed to my channel, I will really recommend you do that. And if you like my video, you can like my videos, you can share my videos to other persons, and you can refer them to my channel on both YouTube, Instagram, Twitter, and Facebook. Bye bye.